People in Scotland die younger than in any other country in Western Europe. People in our poorest areas die a decade before their neighbours in the wealthiest areas. Both life expectancy and health inequalities are getting worse. Scotland needs collective action to change course. Professor Marmot has led research groups dedicated to understanding and addressing health inequalities. This work is manifested in Marmot Places.
The health of a population tells us something pretty important about how well that society is functioning. And health inequalities tells us something about inequalities in that society. Like any scientist, I used to finish my scientific papers with the familiar phrase, more research is needed. I don't know if it was a matter of age, but at some point I thought, what action is needed?
Based on 8 principles, a Marmot Place develops and delivers interventions and policies to improve health equity and takes a long-term whole system approach. South Lanarkshire is now one of the first Marmot Places in Scotland. In March 2025, Professor Marmot, colleagues from Public Health Scotland, South Lanarkshire Council and Community Planning Partnership, local organisations and stakeholders met to discuss and input into that journey.
We do want national policy to come in behind what's happening locally. But what happens at the place base is absolutely crucial. You're much closer to the reality of people's lives. You understand how people are born, grow, live, work and age, the social determinants of health. Of course, there are big inequalities in health within Scotland. There are big inequalities in health within each of the communities, and you know this, within South Lanarkshire. And the assumption has to be that we can, working together, create the environment where people can lead lives they have reason to value, that they can lead lives of dignity, that they will not say that today's children will have a worse life than us, that they'll be able to say that today's children have a better life than us.
In Public Health Scotland, we said that we want to work with 3 local areas in Scotland who are really passionate about improving health in their areas and tackling some of the unfair inequalities that is stopping many people from living the healthy life that they want to live. The applications from South Lanarkshire and from North Ayrshire and from Aberdeen are the 3 that, working with Sir Michael and his colleagues in the Institute for Health Equity, we have chosen to really focus on. Because what we saw in South Lanarkshire and in those 2 other areas was that real determination and that openness to work in partnership and to explore new ways of working so that we can be really honest about what is working just now, what isn't, and how by working collectively we can secure improvement.
About 6 months after I became the leader of the council, someone known to Professor Marmot and known to all of you wanted to meet me and invited me through a mutual acquaintance to an audience with Michael Marmot in Kirkcaldy. That someone was Gordon Brown. What he was doing was a very powerful and very intense kind of matchmaking amongst policymakers, putting people with good, progressive ideas in the same room as people with the power to make them happen, or at least to move them along the way. And we discussed Marmot Places, and I remember thinking then 2 things: that there was an overlap with the role of our community planning partnerships, and that there was a space for national leadership. 2 months later, when Public Health Scotland come to COSLA and present to council leaders of Marmot Places looking for potential pilots and for councils to volunteer as potential pilots, I felt an obligation to put South Lanarkshire forward. But I also wanted to put South Lanarkshire forward for another reason. The board of the Community Planning Partnership brings together all the agencies who shape public services in South Lanarkshire: police, fire, transport authority, third sector, local government obviously, and many, many more. And I want us to get the most out of community planning's immense convening power.
For the past 3 years, the Burnhouse has undergone such a significant transformation. Within this area, the derelict land that was used for flight-it and these young people have created a community garden, a safe space for young people to come and participate. They've created community. We never had a community. I sort of wish I could bottle what we've got in the high backs. It's just a place where the magic happens, where people connect, people talk, people feel included and seen and valued within their communities, and it's so lovely to be a part of that.
Everything that you heard this morning resonated with me. I come from an area of high deprivation. I represent the tenants and all the community members at Spring Hall, Wiltshire. I'm a full-time carer. I do this as a volunteer. Volunteers are the cornerstone of community. This can-do community, that is absolutely accurate. It's powerful, it's passionate, and it's what we need more of. And it's something that I'm determined to work in partnership with South Lanarkshire Council to achieve. It's not easy, quite frankly. Communities are diverse. You're never going to make everything happy. There's always red tape you have to jump over. But do you know what? It's a case of you push through, you battle on, one foot instead of the other. That's effectively what we've got to do.
This is only the start of our Marmot journey. This could be a game changer. Not just here in South Lanarkshire and North Ayrshire and Aberdeen, but across Scotland, as all levels of government and all public authorities learn lessons that can apply across the board. I came into local government to make a difference, and I genuinely believe this project is one of the best chances we will ever have to do just that. The hard work and a real challenge, but quite simply we have to get it right and make a real change, and I believe that by working together with all the partners in this room, we will. Thank you very much.